As you know, the virus has changed and is spreading rapidly. The Omicron strain that has now taken over here in British Columbia means that we are in a different race, in a different storm now. The Omicron variant of concern has taken over the Delta variant and is now the cause of over 80% of the new cases that we're seeing across British Columbia. It varies slightly in the north where it's not quite that high yet, but the data that's posted on the BC CDC website makes it very clear that this has been a variant that has been dramatically different and is spreading in a different way. And those pieces of the puzzle that I talked about a number of weeks ago are starting to come together. It also means that we need to respond slightly differently to this new strain that we're seeing. While we are seeing the rates of hospitalizations and those in critical care slowly creeping up, it's no longer the case that we have 3 or 4 degrees of separation, that you know somebody who knows somebody maybe that might have contracted the virus. The rate of transmission that we're seeing now in British Columbia, like many other jurisdictions around the world, means that at this point, most people in BC likely have a friend or a family member or a colleague who has been infected with the Omicron variant. Right now, in the tug-of-war of transmission, Omicron has the advantage, and we see that in the rapidly increasing case numbers we're seeing here and that we're seeing around the world. For now, in British Columbia, we have taken measures to try and slow that down, and we are coping. But everything we do now makes a difference. Everything we've done up until now has also made a difference. Our efforts have mattered. So many people in BC are vaccinated, are getting our booster shots, and using those many layers of protection from keeping distances, wearing masks, staying home if we're feeling unwell. This is the right thing to do, and this is what will get us through this phase as well. It means a lot of people will get sick, and we are seeing that now. But your vaccine will protect most people from serious illnesses and from hospitalizations. And we need to make sure that we continue to do those other measures as well. We still have further challenges ahead, and they're going to be slightly different challenges now. We know that some of the things that we did all along that made a difference with the strains that we've been dealing with are no longer that useful right now. In particular, because we have that shorter incubation period, it's 3 days, and the transmission is happening much more rapidly, and we have a disease that is much more undifferentiated. It means that a lot of people have milder upper respiratory symptoms that could be very similar, at least early on, to a cold or to influenza. That means that things like case and contact tracing are no longer reactionary measures that are able to work to help us contain this. It means that all of us have to be proactive in how we prevent ourselves from getting sick, but also how we prevent transmission to others. And our challenge across the board in the next few weeks will be dealing with high numbers of people who are off ill. And that may mean off work or out of school. It means out of healthcare. It means healthcare workers and educators who aren't able to go to work because they're ill. And for most of us, thankfully, because of our vaccinations, that will be a mostly mild illness. But the interruption to our business continuity is something that we now need to think more carefully about. And today I want to speak to businesses in British Columbia. Given this rate of transmission, the short incubation period, and the high number of people who are getting ill, we need now all businesses to put contingency plans in place to keep businesses operating when staff are off ill. At this point, given the number of people getting sick every day, we need to reactivate those COVID-19 safety plans. Those were the layers of protection specific to your business that allowed you to operate safely. We need to anticipate that as many as a third of your workforce at any one time may become ill with COVID-19, and they may not be able to come to work. And we need to adapt businesses so we can operate at these reduced numbers. Whether you're a private company, a school, a frontline business, or a healthcare site, now's the time that we have to prepare. It's not about public health orders and us telling you what to do. This is about activating all of those layers of protection available for your business in your situation to keep you from having to shut down because you don't have enough people to operate. So what do we need to do? First, remember, it is not just one thing. It's not about a rapid test. It's not about a mask that keeps one safe. It's about doing everything we can, all of us taking these measures to protect employees, our customers, and our family and friends. Every layer of protection is not 100% effective. It's putting these pieces together that gives us the protection that we need to keep operating. So what we need to do to prepare? Anyone who can work from home, you should be able to do that. Give employees and customers the space they need to stay safe. Remind and reinforce the need to keep that distance from people. Have fewer people in the same location at once, whether you can stagger shifts, stagger start times and breaks, making sure that staff are not all eating lunch in a small, unventilated lunchroom together, using those barriers, plexiglass barriers, limiting the numbers of customers in a space at any one time. Using appropriate PPE protocols. Ensure you have well-fitting, comfortable three-layer masks and having the ability to do things like washing your hands regularly. And, of course, vaccine requirements. These are important. We know they're in place in many employment opportunities, but requiring employees to declare their vaccine status so you understand the risk in your employees. And while vaccine right now won't stop all of us from getting infected with Omicron, it does significantly reduce the likelihood that we're going to have severe illness and be off for longer. It means that we can come back after that shorter 5-day isolation period. And it means that long-term recovery is the risk of having long-term symptoms is reduced. This week, our schools are also doing a staggered start. And this is, again, we know that schools are safe. They're the best and safest place for our children, and they are essential. They're essential for their social and emotional development as well as intellectual development. And it is not because we have any concerns about that. It's because as we've watched what is happening with Omicron and how it is affecting so many people, I have tasked schools specifically to take stock and prepare plans to safely operate over the coming months with the potential for reduced staff and keeping children safely in school and reducing the risk of functional closures because of staff illness. It's essential that we keep our schools open for children, just as we've kept grocery stores and pharmacies and hospitals open. This is going to be and remains our highest priority. We need to do this, and to do this we need flexibility from everyone, from administrators and staff and teachers and parents, and of course, kids too. If your children are higher risk, it may mean things like pausing extracurricular activities to focus on school and the importance of school. Thankfully, we know that COVID-19 remains, and even with the Omicron variant, remains mild in most children. And we know that with the availability of vaccines, it reduces the risk dramatically more for children and for staff. Everybody in schools should be vaccinated, and vaccines are the best protection for all of us. So while schools are most definitely a reflection and extension of our communities, they have not, and we've seen this consistently, and there's no reason to think it will be different now. They are not a major source of transmission. And schools, the measures that we have in place and adding in, going back to some of the ones that we were using early on, means that they are an important place to keep open for all students starting next week. As I said, this remains our highest priority, and I know the highest priority of the tens of thousands of school staff, teachers, educators, and parents and principals and school district staff across the province, and we're committed to making sure that we're getting children back as soon as possible and doing our best for our children across the province. And part of course, one of the important things that we have in schools is that we wear masks when we're in the classrooms, when we're in the school settings, and I remind everybody that the best mask is the one that you wear properly and consistently. And a good fitting mask with 3 layers is equally protective if it's the one that you're wearing. And remember that the mask alone, of course, is not your only protection. You need to use all of these layers, including vaccination, including keeping your distance, including minimizing the time that you're in a crowded indoor space, particularly if the ventilation is poor. I know some people have called for the increased use of respirators or N95s routinely, and I'll just say in the majority of settings, the incremental benefit in a low-risk setting like a school or a retail store is minimal. What is most important is that you have a good-fitting mask that you wear, and you wear appropriately. The other important thing, of course, is as much as possible, if you are feeling unwell, to stay home and stay away from others until it resolves. Don't go to gatherings, no matter how small. And testing is, of course, important. We now, as you know, are at our limit of our PCR testing, and we need to make sure we have that available for people where that test is important because they have underlying risk factors or may be eligible for treatments. So those are things that are really important right now, and we are using the rapid antigen tests that we have to be able to supplement that for people who have symptoms and are lower risk. I also want to say that I'm looking at other areas in our community to make sure that we're taking the best, most balanced approach we can. And physical activity, as I know, is incredibly important for our mental and physical well-being. And I want to thank those who operate gyms and fitness and dance studios for quickly supporting your communities by moving online during this period of high transmission in our communities. I know that this is incredibly important. At this point, team sports for youth and adults, we are trying to continue. However, I want to make it clear that no one, no matter your age, should be traveling for tournaments. And I know there are some leagues that are trying to get around this by scheduling multiple games. This is not about trying to get around or skirt the rules. It's about taking measures that we need to be able to keep providing some of these activities and reducing the risk that we're going to be bringing this home with us, bringing Omicron home, spreading it around in our communities. So all sports teams should be following the VIA Sport guidelines, staying in your local sports areas, and I recognize this isn't exact, but we will work with each of the sports and leagues to make sure that you know what the rules are. And I encourage you all to default to less, not more, during this risk period. Finally, on Friday, we made some, given the challenges in staffing that I heard about from our long-term care sector, particularly as we were going into this long weekend past, we instituted restrictions to essential visitors only over this past weekend. And the intent was always that once we got the rapid testing available and had more plans in place to support staffing, that we would transition to one designated social visitor per resident in addition to essential visitors. I know and we know that our seniors and elders in long-term care have been hardest hit by this pandemic. And we also know how essential having those social supports of visitors is. And we are committed to making sure we can get back to having your one designated social visitor as well as essential visitors as the rapid antigen testing is being rolled out across long-term care homes and as staffing allows in this coming week. This will be in place this week, as these are being distributed to long-term care homes, and every care home develops their plan to support this. A year ago, we faced challenges, yet we had the hope and promise of vaccines for all of us. And a year later, that is absolutely so important for how we are going to get through this next phase as well. We all may be weary, but we can take encouragement from what will be brighter days ahead. It is going to be a challenging few weeks, but we have the tools and we have that strong vaccine background that will get us through. We have faced adversity and we have met head on with unwavering resilience and kindness and adaptability and compassion. Please continue to use all of those layers you have available to you and remind those around you to do that too as we weather our pandemic storm together. Thank you.
Our first question is from Richard Zussman, Global News. Please go ahead.
Dr. Henry, considering what you said around functional closures, should British Columbians no longer anticipate that you are going to put restrictions in place and rather count on sectors to put in policies? And for example, with a Canucks game coming up potentially on Saturday, although COVID could postpone that, should the team put in place capacity limits rather than wait for a provincial order?
Yeah, very good question. And capacity limits and the Canucks is something that we talk about on an ongoing basis. And as you know, the game tomorrow has been postponed for a number of reasons, and we're in ongoing discussions. But in terms of, I've said many times that I want to get out of the order business, and talked a little bit about that today. This is different. This strain of the virus is different. It's considerably different in its in how it presents, in the shortness of the incubation period, in the shortness of illness for many people. And I just want to say I'm very thankful that this strain has arisen now, not earlier on in this, because with the transmissibility that we're seeing and the rapid spread to many people, if we did not have the protection that we have in such a large part of the population from vaccination, we would be in very challenging situations. So right now, we have been through several phases of knowing what it takes to prevent transmission in many workplaces. And we spend a lot of time in BC with our COVID safety plans with different sectors so that we could keep things going. If you remember back to many of the food processing plants and how we work together to come up with the important measures that would help reduce risk of transmission of illness. All of those need to be taken into account now. And it really is. Public health is reactive in terms of case management and contact tracing and outbreak management. But sectors now have the tools to do that from the experience that we have. And you need to, because this is going to affect across the board. And we're seeing that in other provinces, we're seeing that in other countries, everything from trucking to airlines having to cancel flights. Those are the types of things we need to prepare ourselves for. Part of it is doing things to reduce transmission, to allow people to stay home if they're ill for that period of time, but also to have business continuity plans in place. And yes, I do think it is over to the sector now. It's not me who can order these. It's how we need to get through this new wave together. And it is part of how we're working in schools to make sure that we can keep them open for the important role that they play, even though staff may be ill. And that's a large part of what schools, what our community colleges, our universities are doing this week in preparation for a full return next week.
Richard, do you have a follow-up?
I do, and it's a bit of a multi-parter with some things that have gone unanswered over the last few days. Just trying to get a sense of whether the province is considering shortening the vaccine gap for kids. I know some jurisdictions are allowing kids 5 to 11 to get a second dose 3 weeks after the first. Is there any guidance about, with so many new COVID cases, is there guidance around when people who have had COVID recently should be getting their booster? Should they be waiting longer or book immediately? And you alluded to this, Dr. Henry. Is there any shift we've seen in how long people are staying in hospital with COVID now compared to before because of Omicron?
Okay, so the first one, intervals for children, especially the 5 to 11, but also some of the 12 to 17. No, we are sticking with 8 weeks for a variety of reasons. One, we know that that even 2 doses is not going to prevent transmission from Omicron, and we know that even the first dose is really important for building up that strong antibody, but also that cell-mediated immune response. And that takes time to develop. And it's very clearly shown in adults from the work that we've done here in BC that extended interval is very important for having that mature, longer-lasting immune response. And we have no reason to believe that will be any different for children. So we are keeping the interval at the 8 weeks because that gives you the best, longest-lasting protection for whatever comes next. I think it's very clear we're going to be living with this virus in its many different forms for many years to come. And so we want to have the maximum protection from the primary dose of vaccines that we can get for all. Excuse me, in terms of boosters, you can receive even if you've been infected, particularly right now with Omicron, we know lots of people are getting mild infections. When you are feeling better and recovered from that infection, then you can get your booster dose. And we do encourage you to get your booster dose. As we know, this virus is changing, and when we have that immune response to the virus itself, it can be to different parts of the virus, which sometimes gives us a stronger response to different proteins in the virus. But we know that the vaccine boosts that immunity, particularly to the spike protein, the one that binds into the cells. So it gives you super immunity, if you will, if you get both vaccine after you've been infected. So it is important to continue with that. And any time after you're starting to feel better, you can get the booster shot. Third question was about length of stay of hospitalizations, and so that is something we're watching. We have seen a slight increase in hospitalizations, and we're doing a deep dive. We started on the weekend to understand not only, and we're seeing this in jurisdictions in other places as well, to understand how many people are admitted to hospital because of COVID, how many people where COVID is detected once they've been admitted to hospital. We know that happens because we're doing screening in certain cases, sometimes before surgeries, for example, and how many people have underlying illnesses that may be exacerbated by COVID. And these are questions that we were talking about nationally this morning and over the weekend. You know, having a good understanding of actually how severe an illness Omicron is causing by age and by underlying risk factors. So those are details that we still are trying to gather. We don't have a high number of cases yet in hospital in BC, so that's something that, as I've said, we're watching really carefully to better understand the actual severity of Omicron compared to Delta, for example. But early indications show that in other parts of the world and early indications here that a shorter length of stay for people who are admitted with Omicron in people who are vaccinated. So that's something that we'll have more details on by next week.
Our next question is from David Molko, CTV.
Dr. Henry, David Molko here at CTV. I'm just going to touch on what Richard asked, but perhaps put it a different way. One of the things you said just in the briefing now, you said it's not about public health orders and us telling you what to do. So with respect, you're the provincial health officer. When you say, I want to get out of the order business, my jaw just hit the ground. I'll make the leap and say I'm not really the only one. So we're seeing more orders in places like Ontario, indoor dining closed, Quebec, a curfew. Manitoba just announced further school start delays, I think another week or two. So respectfully, help me pick my jaw up. Why isn't that, in your view, the path for us in British Columbia?
Yes, from the very beginning, you know, public health orders are there as a last resort when we want to make sure that people are absolutely doing things, and we want to do them in what we call the least restrictive means. That has always been our philosophy here and how we've moved forward. It's trying to find that balance of doing just enough so that we can prevent the surge on morbidity or mortality. And it goes back again, and I've said this many, many times, to what are our goals of our pandemic response. And, primary is to prevent serious illness, to prevent sickness and death, to prevent overwhelming of our healthcare system. And that's a really, really important one, because when the healthcare system gets whelmed and overwhelmed, as we saw in the north, for example, most recently, it means that people can't get care for other things, not just COVID. And that affects all of us. That has a population health effect. And thirdly, and really importantly, it's to minimize societal disruption. We know that there are really important downside effects on growth and development and mental health if we don't have schools open in person, for example, and that those can affect children for decades to come. So we have always tried to find that balance, and orders are in place to try and make sure that those things that are need to be shut are shut for that period of time, the least period of time possible. And this is, I talked a little bit about people trying to skirt or bend the rules when we do have as many orders as we need to have in place. And thinking about this is not about skirting the rules. It's about trying to reduce the risk from those highest risk situations and putting in place the least restrictive means we can to get us through this without overwhelming our healthcare system and minimizing the impact we have on society. And so that has been our approach here in BC from the very beginning. And we've done this together. We don't have to force people to close to be able to get people to do the right thing and to take those measures that get us through this as well.
David, do you have a follow-up?
Thanks, and Happy New Year, by the way. But speaking of that tricky balance that you've mentioned, I know you've said this and others have said this who are watching, you can be accused of overreacting before things get worse and afterwards accused of really not acting fast enough. But I want to kind of look back over the last few weeks as Omicron quickly flared its head here in BC. This is a question both for you and for the minister. What do you wish you'd done sooner when it comes to your response to Omicron, and how are those lessons going to guide decisions moving ahead?
Yeah, so if I look back on it, and I've said this many times, that there's always trade-offs, and we try and find that balance, and we agonize over those decisions. And I think one of the things that we've had in place is some baseline things for some time, things like mask wearing in indoor public places. And it becomes more and more important to have those baseline measures in place. We've had restrictions on numbers of events and things. And then moving into the holiday period, again, trying to find that balance where we know that it is social gatherings and social connections and types of indoor activities that where we started to see this spread more rapidly. And as you know, we were coming off Delta, so we still had some very strong restrictions in place in some communities that were making a difference. So we were trying to find that balance. I think we did a number of things earlier, including focusing on booster shots on the people who are most likely to end up with more severe illness or end up in hospital. That's something that I think is really, really important. And it will be no surprise to you that I'm going to leave it at that, because I think there's lots of time to second guess things in the future. But we take every decision looking at the data that we have in front of us today and try and find that balance that I was just talking about.
I think what you've seen from Public Health and Dr. Henry is a clear response to the Omicron variant of concern. We put in place public health orders where necessary. A change before last weekend to address issues and challenges in long-term care by temporarily limiting long-term care to essential visitors, and I think those are important steps to take. We took steps weeks ago to say that in January, and gives us time to plan and prepare, that we were going to delay non-urgent scheduled surgeries in January to prepare our healthcare system. And we haven't seen, I think you'll see when the report comes out at 3 o'clock today, you'll see an increase in hospitalizations. We haven't seen the dramatic increase they've seen in some jurisdictions, but we're preparing for that because we expect those numbers to go up in the coming weeks. So action on hospitalization, action on acute care. And I think the decision to focus our immunization, our booster program on those that are most vulnerable was a decision that was taken by our team, by Dr. Henry, Dr. Ballum, by the government. On October 26th, we laid out those priorities for people, and the fact that the vast majority of those eligible over 70 now have received their booster dose, that unlike many other jurisdictions, we focused on clinically vulnerable people, 160,000 of those, on healthcare workers in Indigenous communities. That supports us in these actions. But look, the Omicron variant of concern, we see it in many, many countries in the world and all the other jurisdictions in Canada, is causing a significant increase in transmission. It's in some ways a new pandemic or a changed pandemic, and we're going to continue to adapt and adjust every day, as I think our people in BC. And I think what's really important right now, and I'm happy people can assess and judge, and they will, in BC, but I would say all of us have to assess these new circumstances and recommit ourselves to following public health guidance and orders. And when there are public health orders, because we've been, I think, balanced in dealing with public health orders in the time, those public health orders need to be adhered to. And the public health guidance, you need to adhere to that too for your own health and those that you love. And if we continue to do that, we're going to get through this period. But this is immensely challenging and different than the Delta surge, the previous waves we've seen, the Delta surge, or the challenges at the beginning of the COVID-19 pandemic. And we're going to keep adapting and learning every day. And as our people in BC, and I think together, we can respond well to this situation as well.
Our next question is from Lisa Cordasco, Vancouver Sun.
Thank you. I'd like to ask on behalf of advocates for those in long-term care, they're asking that you make it a requirement that every resident is entitled to an essential visitor. As it stands, about 25% of long-term care residents have a designated essential visitor, and the criteria is applied by individual care home administrators. And so they're asking, will you make it a requirement that every resident is entitled to an essential visitor?
Yeah, so we went through this last summer and working with the seniors advocate and the long-term care sector. And there's two different types of visitors that we recognize. Both are essential. One is a designated as an essential visitor in terms of they provide additional care to that individual, help them with certain things. And yes, that is a decision that's made between the resident, their family, and the facility. But the other one that is equally essential in the life and quality of life of residents is having social visitors. And so we have a designated social visitor that every resident is expected to be able to have at least one. We've had a provision for more than one, and then of course, as you know, over the last little while, there's been unlimited numbers of visitors. As we're moving into this risk phase again, we know that residents are well protected, but because they're older and we know that immunity wanes over time, there's still a risk, and we want to minimize the number of people that are going in and out of long-term care homes during this high transmission period. So I did take the measure of restricting it to essential visitors for this past weekend because we were hearing about challenges with staffing and being able to screen visitors appropriately. And we now have rapid antigen tests that are designated for testing visitors, and starting as soon as they are deployed in each facility, we'll be going to having every resident have their designated social visitor as well as their essential visitor being allowed and being able to visit with them anytime.
Lisa, do you have a follow-up?
Yes. Okay, I understand the history of the visitors and how they're designated. What I'm saying is that, never mind. Let's move on to the rapid test. I'm told also that there are 1 million rapid tests sitting in a warehouse right now that are being denied to a long-term care home. So under your plan, how many rapid tests can be expected to be received at long-term care homes this week? And will there be an exact protocol put in place that is required for every visit or required for the beginning of every shift of designated workers?
That is an urban myth that there's millions of rapid tests in a warehouse somewhere. We have made rapid tests in their various forms available to long-term care for many months, and they have been used in many long-term care. Particularly, you will recall, when we made it a requirement that long-term care staff all be vaccinated, and there was a period of time when rapid tests were used in between times until people got their second vaccine, etc. So they have been available. On the other hand, we have also designated specifically for visitors, and we talked about this about 2-3 weeks ago, specific rapid antigen tests, the nasal tests that are on the lateral flow that we have in, and there's over 100,000 distributed, started last week, to long-term care homes across the province, and that's for every visitor on a daily basis to be tested prior to their visit. Did you want to mention anything?
Our next question is from Camille Baines, Canadian Press.
Hi, Dr. Henry. Thanks for taking my question. With your concerns about businesses keeping their doors open, do you foresee prioritizing booster shots for employees like grocery store workers or teachers or any of those types of groups?
Yeah, so the way our booster shot, or the way our immunization program rolled out, you will recall, is that many of those groups were prioritized for early access once we got through the over 70s, essentially, in March and April of last year. So yes, those are the people that are now, as of this past weekend, starting to get their invites for their booster shots. So we still want to maintain that 6-month interval between dose 2 and dose 3, but many teachers, many other staff who are in the younger age groups will have started to receive their invites starting this past weekend. And that is, it's a combination of the interval and when people got their first and second doses of vaccine. So it automatically prioritizes those workers who were in those settings that were prioritized for getting their first and second doses as well.
Camille, do you have a follow-up?
Yes. What would you say to parents who are still reluctant to get their children vaccinated at this point?
Yeah, you know, there's lots of reasons why parents, especially for the 5 to 11-year-olds, have had concerns. I've talked to many parents about this. It's the different feeling when it's like, okay, I'll take that for myself. But they want, there's a little bit of I want to wait and see how it's going. Want to make sure that I understand all of the ins and outs of how this works and how the clinics work. And what I can tell you now is that we now have done over 170,000 5 to 11-year-old children. I've been there myself at many of the clinics. We have lots of really good information on millions of children around the world who have been vaccinated with this pediatric vaccine, and it is safe, it is working, kids are doing great. It really is important for them. It's important to protect them. We know that this illness, thankfully, is still mostly mild in children, but some children do have serious illness, and there's a level of anxiety that I hear from young people in my life that they're afraid that they're going to get sick and bring it home, or that they're going to pass it on to their friends, and this is an important thing that we can do together. So I would encourage all parents, make sure you have the information you need, talk to your pediatrician, talk to your family doctor, talk to your pharmacist. This is a very safe vaccine, and it works, and it's good for all of our kids, and it's going to be one of those things that helps us get back to a normal school and after-school activities for all our kids.
Our next question is from Delana Nishaw, CFJC News.
Hi, Dr. Henry. Thanks for taking my question. Just for some clarification, within Interior Health, when residents of a long-term care facility are being treated in hospital and are discharged, do they need to be tested for COVID-19 before returning to their living facility?
That is the protocol that normally when residents are transferred back to a facility from a hospital, or if they're an alternative level of care and they're waiting placement in a care home, that they are tested prior to returning to that facility, yes.
Dilana, do you have a follow-up?
Nope, that's great. Thanks.
Belle Puri, CBC.
Hello. The gym owners we have spoken to want to see the data around COVID transmission in gyms. How and when will you be able to provide that to them? And if could you answer in English and French, please?
Yeah. You know, I've talked to a number of the leaders in the fitness industry. They've been part of our ongoing work around where we put restrictions in. And I know these are challenging times. And I can tell you that, you know, this isn't about skirting and bending the rules. And some of the gyms are talking about this. It's also not about that gyms are doing things wrong. Most of them have been fantastic and they're doing a great job. The reality is, and we've seen this repeatedly, that the type of activities that happen in fitness centers and gyms, in some of these spin classes, that these are indoor activities with adults in a group, even wearing masks, where you know that the risk is higher. It just is. It's same with travel. It's the same with certain industries, that these are higher risk industries. And when we have a lot of transmission in our community, we have repeatedly seen the gyms become amplifiers. And we've had a number of examples of that we put out information on. So while I may not have, and certainly right now, I can't tell you every single case that's been linked to a gym, but we can tell you that we've seen this as a pattern, that these are environments that are higher risk, and when there's a lot of transmission in the community, particularly in that age group, so the age demographic that is going to gyms that is highly connected. So there are people who are younger, who are also more social, who are working, have children. So we know that these transmission links are happening and it's spreading into higher risk settings. So it's not about these gyms are doing everything right in many cases, but the reputable ones understand that they're not going to put their staff and clients at risk when we're seeing the amount of transmission that we're seeing right now. And this will pass. And I'm working very closely with the fitness industry, with the sports groups, to make sure that we can get back to doing safe activities in gyms as soon as possible, as soon as this wave passes. And I'm committed to that. I know that my gym that I go to is doing amazing things online, one-on-one and in groups. And we need to do that for a period of time until we can get back to normal.
Le taux de transmission en Colombie-Britannique est 8 fois ce que c'était avant Omicron. Donc, l'industrie de la bien-être, l'industrie des gymnases, cette industrie qui est importante des gyms est importante dans la province. Elle fait un gros travail depuis des mois pendant la période de Delta et d'autres variantes dans la province. Or, avec Omicron, avec un taux de transmission de 8 fois, c'est pas une question de ce qu'on peut faire. Dans ce cas, c'était nécessaire de les fermer, sauf pour des classes virtuelles à l'heure actuelle. C'était nécessaire pour ces raisons. The transmission, the test positivity is 8 times what it was before Omicron right now in BC. And so some of the things that we were doing in the period before Omicron, we can't do now in the same way. And it's very difficult. It's not an issue that gyms didn't do what we asked them to do in the period beforehand, because we did. We worked together on that, and public health worked very closely with the industry. But we're in a different situation now that require that the action take place. Obviously, now that gyms are not open, that the information or the evidence you've asked for will not be attainable now. But public health rightly determined that they needed to take action. And this was one of the areas that needed to take action in this period of very high transmission of COVID-19.
Belle, do you have a follow-up?
Yes, please. When you consider the types of situations that could force the closures of schools, what level of sickness would have to be in place to trigger such a closure? And, how much notice would parents be given if the school was about to close? And once it closes, would the learning just go online?
Yeah, that's the reasons why there's a number of days here for staff to address all of those specific questions. Those are the things we've been working with them. What are the protocols for reporting of how many people are absent, whether it's students or staff for sickness, what type of illness are we seeing? These are things that we have in place for influenza and norovirus outbreaks in previous years. So we need to put them together and make sure that they're school-specific and district-specific. So there's what the planning scenarios we're looking at, and I talked a little bit about this for business, is, up to 10% of staff are off ill. What do you do then? Up to 30%, how do we manage? And what triggers would mean going to some sort of a hybrid? How would we manage it within a district, within a school? So that's the reason why we're taking some extra time to put those protocols in place, because it'll vary. A school in a small community where there's not as many staff available to support. How do you have mixed classes if you need to support with students off and staff off? Those are all the things that are being worked through this week, and why we had a phased return, so that we could have those clearly articulated, and parents will hear from their districts about that. The one thing I will say is that it is not possible for us to report cases and exposure events in the same way, given the transmission that we're seeing. So how that will be reported from schools to parents, and public health will be supporting schools in doing that, is also how we need to work that through this week.
Our next question is from Lisa Yuzda, City News.
Hi there. One thing I'm hoping, Dr. Henry, you can talk through. In Toronto today, John Tory was talking about how the peak in Toronto will come 4 to 6 weeks from now. What kind of timeline are we looking at here over the next month or two?
Yeah, I didn't hear that, but I think that's probably more pessimistic that I'm seeing when I look at what's happening in other countries. We look at Denmark, we look at the UK, obviously South Africa. When we started to see the rapid rise, it's hard to know when we're going to see a peak. I think with the shorter incubation period, the shorter length of illness, that we're probably going to see a shorter peak than what we've seen with previous waves. But, it is day by day looking at what we're seeing. And what we're trying to do is flatten that out a bit, which will extend it somewhat. But if we can flatten it out, then we can protect better our healthcare system, because even a small proportion of people needing hospital care can have such a dramatic impact on the healthcare system. So I won't venture to say, but I hope that it will be shorter than another 4 to 6 weeks for sure.
Lisa, do you have a follow-up?
Looking at you talking about mitigating or figuring out how schools will manage, say, if 10% is off or 30% is off sick, looking at hospitals and our healthcare system, when are we going to hit the point, 2 code oranges at hospitals in Ontario, when are we looking at that happening here, and how is that mitigated? If a couple of the hospitals, let's say here in the island or in Metro Vancouver, are code orange, how do others absorb it? Like, what happens in the worst case scenario?
Yeah, so this is something that we are also planning for, and I talked a little bit about this last week, but one of the responsibilities of my partner, Deputy Minister Stephen Brown, and we've been looking at this for some time. It is part of our pandemic planning scenarios, is how to maximize the workforce. So one of the big things is making sure everybody's vaccinated. That was an important key point in trying to preserve our healthy healthcare workers. Looking at the period of time of isolation that's required, looking at who can do specific competencies and specific jobs so they can backfill, maximizing hours. And I know we've had in some places had to ask people to come back off holidays. So there's a whole series of measures that we're taking, looking at our health human resources, recognizing that, we've been stretched. We've been stretched prior to the pandemic, and people have been stretched to the limit and beyond during this last 2 years. So we are trying to make sure we can continue to scale up our immunization programs, and some of the things like scaling back on surgeries is a really important thing. There are a number of public health activities that we are no longer doing so we can support the activities in the pandemic. So this is an ongoing health human resource planning that we've been doing for some weeks. And it will continue to do. And I talked about this last week. One of the things that Quebec has talked about is allowing healthcare workers with mild or asymptomatic COVID to come back to work. So we do have protocols for that, should that be required, because that would be absolutely a last resort, and we'd only want them to work with COVID patients, for example, so that we wouldn't increase risk anywhere else in a facility. But the protocols for how that would happen, what we call fitness to work protocols, those are all developed as well.
That's all the time we have today for questions. This concludes today's event. Thank you, everyone, for joining.
Thank you.